Thank you all, and welcome to the New York Waivers Program webinar. We are going to be talking about lots of things, lots of waiver stuff, lots of things changing, happening, or things that you didn't know about. So, my name is Nicole Christensen. I am the proud CEO of Care Answered. Care Answered provides patient advocacy and care coordination. We navigate people through the healthcare system during the most challenging times and times of transition or more care need. We get healthcare done. I'm also the founder of Answers for Care. That's answers, the number four, care.com, which is a one-stop shop for aging care solutions. And we all start aging when we're born. So that's for all of us. And what we have on Answers for Care is vetted professionals that are the best in their work all over Long Island. And one of those professionals is here with us, Samantha Lawson. So, again, my name is Nicole Christensen. I also am the best-selling author of From Crisis to Calm, and we're going to get right into it because we want to hear what's going on with New York waiver programs. Again, Samantha is one of our pro members on Answers for Care, and she is a service coordinator for New York Waiver Programs. One of her real thoughts on being a service coordinator, and this is such an important, and some people just don't know about it, this role. And I've worked with Samantha at YHP Cares, and they do an excellent job because the waiver programs and the services that are involved are actually extraordinary. And if you don't have a good service coordinator, you won't have access to all of those services. It's not just home care, it's a whole lot of different services that is really individualized based on what your need might be. So they are service coordinators who are empowering independence with compassionate, culturally attuned care coordination for aging and disabled New Yorkers. So I'm so excited to have her here to tell us about these waiver programs. So thanks so much, Samantha.
Thank you. Thanks everyone for coming. I hope you guys can hear me okay.
Yes, we can.
Okay, great. So I'm just gonna start up our little PowerPoint here. Um, so the waiver programs are home and community-based waivers, and they're from the center of Medicare and Medicaid through the federal government, which we all know is CMS. If you know, you know. If you don't, you don't. But the CMS center basically kind of sends out, funding, data, and everything throughout the states. And for New York State, their home and community based at portion through Medicaid has what's called the 1951 waiver. And let's go through it. Oh, did it skip? Sorry. And basically, these waivers exist to help people live safely in the community, provide an alternative to nursing home placement, support independence, choice, and dignity. Like I said, they're funded through community-based services. Two of the waivers that we're going to discuss that I work for, YHP Cares, is a service provider for TBI and Medicaid, TBI under Medicaid, and nursing home transition and diversion under Medicaid. So basically, these programs, they allow for the informal supports to get extra care. Sometimes a client might not have informal supports. That's like their family and friends that are helping them out. It might just be them by themselves. So it's a state plan Medicaid service, but it's also if their current services aren't enough. So maybe they're on a state funded program like managed long-term care, but they're not getting enough home health 8 hours. Sometimes it could be that they're they need services to even get more therapy hours for like OT and PT. And the main focus is to keep people in their homes. The philosophy of the waiver is that the participant is the primary decision maker. Sometimes when we say it's the participant, their family actually has the locus of control through legal authority or home or healthcare proxy. So they are also part of that decision-making team, or again, sometimes it's them themselves. We want to preserve their dignity, and we want to make sure that, risks are limited and mitigated while they're under these services. So these services for NHTD, it's a waiver that supports individuals who require nursing home level of care, and they want to avoid being in the nursing home. They want to stay home, they want to stay in their community. And when we say home, we typically mean like their apartment or, private housing. So if they're in and assisted living, they actually cannot get access to these services. And the state qualifies assisted living by saying if there is a congregate meal area, they can't have access to these services. So if there's some type of lunchroom where different people that live in the assisted living come and eat, they can't have access to the NHTD waiver. But if they're in like senior apartments or something like that, then they're able to get the NHTD waiver. The TBI waiver, same thing, is for people that are dealing with traumatic brain injury diagnosis. So maybe they had a stroke, maybe they were in a car accident, maybe they had like a cancer that impacted their brain or some type of neurological issue. And basically, this program, of course, it allows for home health aides, but the big point of this program is to address cognitive, behavioral, and physical challenges and make sure like they have as much independence as possible while they stay in the community. So they also require nursing home level of care. For both programs, you can be 18 and over. The only caveat is that with traumatic brain injury, it's 18 to 64. So if you're over 64, you would have to then apply for the nursing home transition and diversion waiver. So say you put in your application from the date your application goes in and they receive it, as long as you're under 65, you could stay on a traumatic brain injury. But if like you apply on your 65th birthday or a few days after, you'd go to NHTD. And with that, you need at least one waiver service. And basically, you're always going to get at least one waiver service because in order to get on the waivers, you need service coordination. So we are that one main waiver service that's required. Then there's other services. So I'm going to skip over that because we kind of talked about that. So diving into the other services, you have independent living skills trainer. So what they do is they teach the skills needed for daily living. So they help with like cooking and meal planning, budgeting, community navigation, and other household tasks. You have positive behavioral intervention supports. They help manage and challenging behaviors. They focus on coping strategies and positive supports. The plan for them and how that care is managed, they have an individual assessment that's done once they're onboarded onto the waiver. Like once we get them on the waiver, a PIVOS director comes and they conduct an assessment, and then from there, that's how they'll know how many hours they need and what their behavior support plan is. Then you have, and this is the big one for NHTD, Home and Community Supportive Services. Also, we call it HCSS. We go by the initials for everything. We don't use the full words. We can't. And that's the hands-on support and supervision, or the home health aides. So they provide personal care, daily routines, safety and oversight. One of the things they don't provide, and I think it's critical for people to know this, is that they can't give medications. So if you set up like your participant or your relative, whoever, with like a pill box, they can instruct and cue them to take the medication. But if there's medications that need to be administered, such as like a medicated cream, injections, they don't, they might have a feeding tube and medication needs to be administered that way. Someone from the family or a person with there's a certificate that they have where it says like they can give a person their medication, a nurse or someone like that. And I might have put on the slide, I might not have, but I'll dive into who can actually help with that in a moment. So another support we have is community integration counseling. And what they do is they kind of connect the participants to the community, they engage with them, They give them like some goals to focus on. I had a client who really wanted to reconnect with their child. So their CIC helped them with finding things that them and their child could do, ways to get to and from. They had like, some limited medical transportation. They actually had social transportation through MAS to be able to go and pick up their son and everything, but it wasn't as much as they wanted, like what they were approved for. So it was like helping them figure out how to take the train to their house and things of that nature. Um, they also do a little bit of therapy. So they are typically social workers or mental health counselors. So they do provide some therapy with the client, just to deal with their emotional needs a little bit. And then you have structured day program. This is great. It allows the clients to kind of get out, make friends in the community at a day program, have some recreational activities, socialize. Um, and they're usually in like an approved setting. So RES has one, head injury has one, and they're for both like all of these are for NHTD and TBI. There's healthy meal delivery, so they deliver like one meal a day throughout the tenure of while they're on the program. So they get 365 meals, right? That's the amount of days in a year, right? So they hit 365 meals. And it's really to like promote their health and wellness. The person comes with them, so it's a little bit of a social interaction. It's really good. At first, I didn't have many clients taking it, but we've kind of been talking to them about it, and the ones who have started, they're really happy to have it. You can get environmental modifications done on this waiver, ramp bars, like you could have ramps added to the home, grab bars in the, shower, bathroom modifications. Um, sorry, I want to go back. Uh-oh. You can also get modifications to the car. Like some people, they're still kind of mobile, but they may need things added to the car so that they can use it to get around. You can get those things added. That happens after you get on the waiver, though. That's something we do later in what's called an addendum. Then there's assistive technology. So I have clients that need like devices to help them communicate. Maybe they have something wrong with their speech and or they need devices because they're hard of hearing. They help provide those devices. And so really fast, I just want to dive through the enrollment process. So the referral begins with us. We only service Long Island, so Nassau and Suffolk County. And what we do is once your lawyer, your family member, you reaches out to us, we actually submit the referral for you to Silo. So we speak with you, explain what the waiver program is, and then we take your information and submit it to Silo. The waiver outreach is 12 to 16 weeks. Right now it's about 16 weeks. There is a little caveat to that, and I'm going to dive into why in a second. And then typically, once you started with us, they'll do an interview with you. Silo will do an interview with you, and then they'll send you some documents to fill out, and there you select your service coordination agency. So you would select obviously us, Watch Cares. Then once that part's done, we meet with you and we do an intake in your home, or sometimes we have to do it at the facility because the client is trying to come out of the nursing home and go back into the community. So we might meet with you there. And what we do is we develop the initial service plan. Then the HCSS agency, if you are getting home health aides, comes and they do their home assessment and a UAS. So the UAS is it's basically a assessment, it's a uniform assessment that states that this person needs nursing home level of care. And then we submit that packet to Silo. This process can take up to a month. Um, the faster you have everything that you need, it can be faster. And then the faster we can get HCSS in there to do their assessment. So it could be anywhere from like 2 weeks to a month. We submit that to Silo. Silo has about 60 days to review it. Then they issue their approval, which is their notice of decision or denial, but we're only talking good stuff here, so approvals. And then You're assigned your official start date on the waiver, and then services begin. So after enrollment, you have monthly service coordination visits. So you talk with us monthly, basically about your care. If you need to do Medicaid paperwork, maybe you're having issues, you need connections to services that we know about in the community that might be free or low cost, things of that nature service coordination does with you. We also conduct two team meetings a year, which is where all the services that you are approved on your plan meet up with you and go over like how things are going, if there needs to be any changes, if things need to be added or removed. We do that twice a year. Services, again, are delivered based on the approved plan. And then we do ongoing adjustments as well as we update the plan every year. So an adjustment to your plan, we call that an addendum. Sometimes you want to change providers. That's a quicker process. That's done pretty quick. And then um we write your plan every year to maintain your status on the waiver. So why I say to choose us, honestly, if you go on our Google, well, one of the reasons is this lady right here. I don't know if you can see her on the screen, but there's Erica. She's one of our great service coordinators. I'm just going to shout everybody out by name. We have Selena. She's also on the line. She's one of our amazing service coordinators. There's Stephanie Lombardo, and we have a new service coordinator named Francisco Feliciano. Our supervisor, Karina's excellent. She makes sure everybody kind of like knows what they're doing. Their questions are answered in real time as far as our staff goes. And then you have our amazing assistant, Delnice. She keeps the wheels running with me. She works probably with me closely. And I think one of the top reasons to work with us is that the president's easy to reach, which is me. I'm pretty easy to reach. I actually don't provide, I am a service coordinator, but I don't provide service coordination. My staff does. But if you need me, I'm here. You can text me, you can call me, you can email me. You can send up a smoke signal, just not on a cloudy day. But I'm pretty easy to reach. We focus on a person-centered approach. Our coordinators are experienced. They have most of them have 5 or more years experience in this field, whether they started as a direct support professional, an ILST, a PBIS, a jobs coach. Like they've been in it and doing this. This is what they love to do. And they even have done other things in the community, like working with the fire department, working with other in other areas with people with disabilities. I do a lot of community work just on my own. So this is what we care about. We care about people's dignity and we care about community living. Another thing, one last thing I'll mention is we are very, very close with a lot of the providers. I've made it a point to build those relationships with the other home and community supportive services, with the ILST agencies, PIVOTs, the agencies that provide the other services like ILST, PIVOTs, EMODs. I've made it a point to like reach out, talk to them, go to their Christmas parties, their lunches, their birthday party, whatever it is, to keep that relationship going. Because one thing I notice is when you're close with them, they make sure like they're reaching out to you about whatever's going wrong or right with the client. It could be like, hey, this client's made so much progress. What else can we do? Sometimes it could be, hey, like this family's struggling. They don't, they're worried about this, they're worried about that. They're going through, end stage of care. It's time maybe for referrals to at home hospice care, things of that nature, or just even how to approach that discussion with them about the fact that their loved one might be moving on to, as I would say, to glory. So if you have any questions, you have referrals, next steps, anything, you can reach out to me. My number is 631-357-7223, and my email is slawson@yhpcares.com. One thing I did want to mention, especially if you're kind of like a elder care lawyer, you're kind of working in this field, is the NHTD waiver cap. So TBI is still open, running. If you need to apply for that program, please do not hesitate. It moves a little faster because it's not as many people enrolled. but NHTD is technically over enrolled. So a cap was initiated um, back in the summer, and basically it's now in effect. So at some point, I think they were only supposed to have 9,400 people on the waiver. It's way over that. I can't even quote the number, but I think it's about 13,000 or somewhere around there. And that's for all of New York. And basically CMS was like, hey, you gotta cap it. It's too many people. So right now, if you're not in the pipeline, which means that you sent a intake referral back to Silo prior to January 26th, you will receive a letter if it's after January 26th stating that the waiver program is closed. Now, it's not closed forever. They just have to wait for people to be disenrolled. And, unfortunately, sometimes that means passing on, or it could mean that they're doing a lot better. Some people have disabilities like I had a client who had a hip issue with their hip. They needed these services, I think, for a year or so. And now they're not, they had like more home health 8 hours, and now they're using way less. And then their goal is to eventually not need home health 8 hours at all. So it could just mean something like that. But they have to wait for people to come off to add new people on, and there's no waiting list. So if you did need to do a referral with us, we can always do the referral, hold on to it so we have it. And if we need to update the dates once we know that they're supposed to at some point tell each region. So like again, I'm the Long Island region. There's 5 boroughs, there's Capital Region, there's you know, Erie, Buffalo, like they'll tell us, or Adirondack rather, they'll tell us, hey, we have this many openings for New York, for Long Island. They'll let Silo know we have this many openings for Long Island, and they'll send it to the waiver service providers, especially, well, service coordinators, so we can get those referrals and HCSS. So that's really it with my presentation. If anyone has any questions or anything, just
We do have some
let me know.
questions.
Okay.
Um, Gail says, I work with patients that have neurological cancers. What documentation is required to qualify for the TBI waiver?
So if they have like a neurological cancer, something from either probably their neurologist, or the if they're, I don't know if this is the field. No, don't get me wrong, 'cause it's not something I encounter a lot, but if they have like a neurologist that specializes in oncology, you'd want like a letter from them stating when the illness started, how the prognosis looks, how, like they're going to need ongoing care, what changed in their status. Maybe they were fine at the beginning, they were functioning pretty normal, but after like chemo and things of that nature, they've had a serious decline. Maybe they lost use of their arms, or they lost use of certain mobility, being able to speak. Things change, especially when they impact the brain. So, and just good documentation from the doctor. That's the very, very critical.
Um, Sam, can you take your thing off share? Because it's just a black screen. I want to be able to
Sure.
see your beautiful face. Okay, there's another question here. She said, got it. Would a LOMN and progress notes suffice? These patients need so much help. Letter of medical necessity. Thank you, Gail.
Yes. You know what? I do not know how to take this off of
So
share.
you just go under share and then just say
Mm-hmm.
stop share.
Oh, there we
There
go.
you
All
go.
right,
You did
that
it.
helps. I don't know how I missed that. Um,
So you were saying that that could be super helpful.
yeah,
The
that's perfectly fine. That, because it says the diagnosis, it usually has like the ICD-10 codes or whatever, and it usually says like how long they've been dealing with this. So yeah, that's perfect.
And if they're on Long Island, they can talk to you, right?
Yeah, they
Even
talk.
those who are facilitating. So I'm a patient advocate, so I've had clients who I referred to YHP Cares, and so I have that some of that information to make it go as smoothly as possible. So definitely talk to YHP Cares to see what they can do. Do you have an experience with patients qualifying with I'm sorry. You could come off of
Glioblast,
Gail. I can't.
glioblastoma.
Oh, I'm sorry. I can't see that. I need glasses.
Yes,
Sorry.
Um,
glioblastoma.
yeah,
Yes.
that's an unfortunate brain cancer, but
Yeah.
yeah, they would be able to qualify
Okay.
for TBI because that cancer is now, impacted their brain. It has to show that there's an impact on the brain. Now, a lot of people sometimes think that, like, and I should have mentioned this earlier, they think that like dementia or uh Alzheimer's counts because it does have a brain
Mhm.
impact, but it actually is not a part of TBI. But like if you had someone young who was diagnosed with, they're over 18, under 64, and they were diagnosed with that cancer, that would be a qualifying illness.
And
Yeah.
the
So I think
Mm.
traumatic is the important word there. I'm sorry, you said something else, Gail?
yes, I was just going to ask. So if by age they didn't qualify for the TBI waiver, would they qualify under the other program, the
They
NHTD?
would, but
Okay.
there is definitely, a wait with that for spots to open up at this point.
Thank you so much.
You're
No
welcome.
problem.
And so one of the important things to realize is that there are always options here. And this is the NHTD waiver. I know that some of us that have been in this industry long enough have been working with it. Um, and it's been a wonderful option. I hope that some good things will come soon. But there are other ways. I know as a patient advocate, I work a lot with all of these fabulous service coordinators and providers, in addition to appealing when they have community Medicaid to get more hours. So please, even though this is not great news for NHTD, it's important news that everybody know about, and TBI especially to know about, because I've had a lot of clients. I was speaking with Sam earlier that are younger, and unfortunately these things happen, and it was really a godsend. And I can't state enough how important it is to have a great service coordinator, because all of those things that were listed, it goes, as you can see, much far beyond an aid. It's not that that's not extremely important, but there's so many services, and I don't want people to go without just for lack of knowledge.
All right, absolutely. Someone asked for families who don't qualify for Medicaid, but are still trying to prevent nursing home placement. Are there alternatives? So I would say that you probably still can qualify for Medicaid. I would always say, there's a lot of elder care lawyers you can reach out to, and you don't have to be elderly to reach out to an elder care lawyer. If you have a family member with a disability, they might
A
still
special needs
qualify.
attorney as
y-
well. Mhm.
Right. You might still qualify for Medicaid. A lot of families have to do some legal processes to adjust how their assets are allocated and put money in trust so that they can still have access to that money for their care. So like say they need to pay rent, they need to buy groceries, you don't want to have I've seen it, $8,000 spend down. You want to put that in a trust, especially if you know you're not spending $8,000 on medical care a month. You want to put that money in a trust and be able to use it. So I wouldn't say that if a person needs nursing home level of care that they don't qualify for Medicaid. Just, I mean, they might not qualify to be able to just go down to DSS and apply, but with the right attorney, you can probably get them on Medicaid. I would always go that route first. You might need to
Yeah.
shop around for rates or whatever, see who's affordable for you that can get it done. Try to go with good referrals, but don't let that be a deterrent. And
Yeah,
if
one of the things, I'm sorry, I didn't mean to cut you off. I just wanted to add to that really important point. What looks like you may not qualify in black and white when you see it may not be the case. And fortunately, at Answers for Care, you will find all vetted providers, Medicaid specialists, elder law attorneys that can walk you through it and make sure you know all of your options, as well as advocates like myself who work with those great professionals. So, so don't think that it's definitely a no. it could be a yes. And finding out what your options are is so important. Again, go to Answers for Care. I don't say that just because I'm the founder. It means a lot to me because the reason why it was created was so that people can go in with confidence, knowing that there are people that are vetted, background checked, know their stuff, are the best in their field. It's very exclusive, and that you can talk to and or reach out to us just to see what other things might be available to you. So the other thing I would say along with that, Sam, is that sometimes if you've done all of that research and you don't qualify, what else is there? I also say, people, I've had clients who've had long-term care insurance that their family had no idea they had long-term care insurance. There might be a thing like that. Or if they have a lot of funds, well, people work really hard or they have very good fortune to have funds when they're older. This is the time to use it. I've seen a
Mm,
lot of times where people are like, no, 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 I don't want to use it. I don't want to use it. Well, this is what it's for, right? And it helps your family to know, hey, these services are in place. They don't replace money does not replace family, but to know that there is some funds there that are available to you, don't not use it. I say this with
Hmm.
long-term care insurance as well. We had Rona Loshak last month regarding long-term care insurance. I've had clients that said, "Oh, I'm waiting," and they're 95. No, no, we're not
Wow.
waiting. We're getting the care that we need because
Hmm.
that's why we did this. So, there are many options. If you don't know what it is that it could be, give us a call at Care Answered or Answers for Care, and we'll find appropriate professionals for you if it's not ourselves. That was an excellent question. And thanks so much. Let's see if we have any more. And anybody could take theirself off mute as well if you have more questions. All right. I hear silence because you did such a great job,
I hope
Samantha.
so. I hope I answered it well. There was one more service I wanted to say
Yeah,
we
tell
had. I
us.
realized I left off the slide because it's honestly pretty new. It's only been maybe in a year. I think it's
Hmm.
been like a year. I think Olivier's on here. HVMP's only been a year, right? See if he answers. He's not going to answer. So there's this service called Home Visit by Medical Personnel. It's it's pretty new to the waiver. And basically what it is you get a 1 hour visit weekly with a medical professional. Usually it's a nurse practitioner. It could be a doctor, but as of right now, mostly I've seen nurse practitioners. And they can, prescribe like what's allowed for nurse practitioners to prescribe. They can also do like if the person needs like a weekly injection, they can actually also sort out the pills for the client. Like say,
Wow.
especially, they don't have some like again, some clients do not have family that can do these things. So they can come each week and kind of like set up the pill box. Like that could be part of their 1 hour with the client. Um, they can write the prescriptions for incontinence supplies, other durable medical equipment. So it's really kind of a good service. It's really new. Like I think it just,
That's amazing, Sam. I did not
yeah,
know about that. Once a week?
yeah, once a week, but it's only
Great.
available as of right now for the NHTD waiver.
Okay.
And with the waiver, they do have like a cost limit. So I think it has to be under $1,000 daily per client. So if you have 24-hour care, you might not be able to get it. But
Mm,
so far, they've kind of been allowing it. So I'm just gonna lead with that because I don't like blindsiding people saying, yeah, you can get this and you can't. But
right.
for the most part, they have been approving it, and it has been really beneficial to families that really need that, especially when there's not someone else there and they kind of need those pills set up. Or, I had a client that needed a weekly injection, so they would come and do the weekly injection.
Yeah, that weekly injection is huge. Um,
Yeah,
yeah, thanks for sharing that.
no problem.
I just had one other question. Is
Sure.
there
Mhm.
an expedited process for applying for the programs that are open?
No, I'm just gonna be honest.
Yeah.
No. Uh, um, I mean, we've been able to kind of get people onboarded within 6 months, 6 to 8 months total. And I mean, that's total time. Sometimes it's a little less. But I mean, there's a lot. These programs are funded by political entities. So what the allotment for like the Regional Resource Development Center, they're allowed a certain amount of money from the government to actually run the center. And then their contract is for 5 years. So by the time they get their contract, for that 5 year period, they need more money. So they're a little, to be quite frank, they're understaffed. So that's what's kind of making it take so much longer. And that's on Long Island. You go in the boroughs, it could be even longer. With the five boroughs in Westchester, it can be a little, can be longer. But
It can be longer, like most things.
yeah,
But
from
with
start to
Medicaid,
finish, yeah.
with community Medicaid, there's something called immediate
Correct.
need. These are not
Yes.
the waiver programs, but there's something called immediate. But I always say to all of my clients and anybody who will listen, there's nothing that's immediate in New York State.
Mm-mm.
So we are immediate and they're immediate, maybe two different things, but it does run faster than usual community Medicaid.
Yeah, I
One
only
thing,
ask because I work with patients end of life.
Mm,
And, even if you're referring for hospice, it's very limited support.
hmm
And with,
yep,
that diagnosis that I mentioned, families need a lot more support. And
hmm
6 months to a year, 9 months
that
even,
that
may not help them
Yeah,
right.
some
I
cases.
understand. I
Mm.
have I have clients that are coming on, and they're in their 90s or they do have an illness. Some of them have cancer, and things are very touch and go, to be honest. So that is an issue. I'll be honest. I had a client over the summer that by the time we got approved for the waiver, they passed the night before. So that's kind of like,
That's heartbreaking.
yeah,
Mm.
it's kind of like the course of it. Um, what I will say is though, one thing that does help kind of speed up the process is the fact that we actually do the referral for you, because typically when a person is doing it themselves, they have to call Silo and leave a message almost like some people do daily, but that's kind of extreme, but at least like 2 times a week until they get them on the phone to take their information to then call them in 13 weeks. So because we do that for the participant, the future participant, it does shave off quite a bit of time, like a big amount of time. So now they're only waiting that 12 to 16 weeks to get an intake. TBI could be less than 12 weeks because it's not as big of a program. Then we do move fast. Like once we get the go ahead to work with the client from Silo, I mean, Erica can vouch for this. We're pretty much on the phone with them within like, within 2 days if they answer. It's really up
Right.
to like,
Yeah. It's about
if
them
they answer
answering.
the phone. If they're not, we're texting somebody, like we're reaching out to you to get the ball rolling relatively quickly. And then we do our parts quick. Like we don't leave you waiting. Um but the if you have all your documents together, like medical records, financial documents, ID and things of that nature, that makes it go faster. If we do have a couple questions, the participant or their family answers quickly, that helps. And getting the HCSS in there relatively quick. Some agencies work faster than others. And if that question is asked of me, I will tell you who, but I can't recommend an agency and be like, say, go with this one. But I will tell you who kind of moves quick. I'll give you my honest opinion, and then you go from there.
And the other thing is that that's why this information is so important, is because we tend as humans, right, not to take action until we know about something. And if we don't know about it until eh, it's more than needed, that always causes more problems as well. So now that you know, when people are facing this situation, even at first diagnosis, to try to get the ball rolling. Just working as a patient advocate again, this is what we're doing all the time to try to inform so that we can get those services in place, not having them say, "Oh, I wish I knew," right? So that's one of the things that makes it quicker too.
Oh, thank you so much. I just saw one of the comments.
Yeah,
No,
that was very
that's
lovely.
That's accurate. One thing I will say, and I normally wouldn't do this, but I am. I think that, you as a community member, you do have the right to advocate to your local government for these services. I mean, um, one of the things they say, like if you run a business in the healthcare community, reach out to your local representatives and have them come for a visit or do a presentation about what you're doing with them, because they do go up to Albany and fight for these things. And then Albany, the people that fight in Albany go to DC and fight for these things. So if you can join them, you can reach out to them, you can go to Albany, whatever you can do. That little, I know it's a little bit of activism speech, but that activism does help protect our community, our sensitive community, our community that needs higher levels of care. The more we advocate for them, the more we can fight to keep these programs going, expand them, get more dollars, see what other things they're willing to add, like they added home visit by medical personnel. So that's my little soapbox speech for that part.
No, I think that's really good because we're all empowered as humans, right? And it affects us, affects our clients, it affects our family, friends, colleagues. So your voice matters in whatever it is. So thank you for that. Well, I think that's a wrap. Thank you so much, Sam, for your excellent presentation.
Thank
Thank you
you.
all for being here. And again, this will be recorded, so look out for it if you missed a few minutes. So it'll be out there for you.
Thank you.
Okay.
Thanks for having
Thanks.
me. Bye, everyone.
Absolutely. Have a great day.